Nearly everyone has experienced back pain, and for some, it is chronic pain. Surgery to relieve the pain is usually considered a last option. Now, new, less invasive procedures are offering promise for patients with certain types of back pain. The University of Colorado is one of a handful of centers across the United States involved in a clinical trial looking at one of these procedures. Whether you have it or hope to treat it, you know it's awful.
It kind of takes over. You know, you live by how much pain you're in that particular day. And
it affects your mood, it affects your personality. It changes how grumpy you are on a day-to-day basis. And that, over time, becomes chronically debilitating.
All right.
Erin was in that place. Not anymore. Her back pain used to limit her life as a mom, as a wife, and an employee. Here is the quick backstory to her backstory.
I had all kinds of different tests done. I've done chiropractor, I've done acupuncture, I've done massage, I've done Pilates, I've done multiple kinds of injections, and nothing seemed to help.
Most typically, it's in the buttocks area. It starts a little bit on the side of the spine and then goes down the back of the leg through the buttocks area.
Very common and yet often misdiagnosed. What is blamed on the spine or the hip may very well be the SI joint.
The joint between the sacrum and the iliac bone is the sacroiliac joint, or the SI joint. That joint really doesn't move or isn't supposed to move in most adults.
Injections into the SI joint can properly diagnose the pain. SI fusion is an option, a surgery that has evolved over the years.
We had to make big incisions and large exposures to get down to the joint, and it would be a very morbid procedure to clean out the joint, to try to put plates and screws across the joint, put bone graft in there, try to get it to fuse. With this newer procedure, we take these metal implants, which are specially designed with a porous coating, and we use our navigation system to minimally invasively put them across the SI joint and stabilize the joint.
Dr. Patel has been doing the fusion surgery for a few years now. Initially, he was a reluctant believer.
And I was pleasantly surprised. I was impressed with how much benefit we were able to get them.
Very super careful because they're tiny.
Erin had the surgery 6 months ago. 6 weeks later, the crutches were gone and Erin was back to her life, no longer letting her back control her life.
They're so used to me having to say I can't do something because my back hurts. It's nice to not have to worry about having back pain, to just say, yeah, you know, I can do it.
Dr. Patel says it is critical that you get the proper diagnosis before you consider any surgical procedure. The clinical trial at CU will compare the SI fusion to physical therapy, injections, other manipulations, and see what is the most benefit for people with this type of pain. Also, we have something is really cool on our website right now to help anyone with back pain. 9 tips to avoid back pain and 9 myths about back pain. Both lists are really helpful, and they're worth sharing with a friend, somebody that might have back pain, and many of us know someone in that position.
Oh man, we know so many
9
people.
tips and 9 myths, and that'll provide more answers for you about back pain.
Is
it's
one of
so
the myths
common.
Never have surgery? Is that one of the myths?
Well, the myths are about surgery is always an answer, because Dr. Patel, who's a spine surgeon, said you really have to think about this. Even this fusion, which is much less invasive, he wants his patients to be on crutches for 6 weeks.
Oh, really?
He says that he's very conservative when it comes to that. So it's a lot to consider. Erin is doing great. She said just in an email today, hey, I'm enjoying summer. I'm having a ball. So it's good for, you know, but it's the proper diagnosis, and he really emphasized that. Not everyone has that SI joint, but many people do, and it's misdiagnosed.
How many people do we know with back pain? I mean, Kim and I know, including my colleague here. We know a lot of people with back pain.
Lots of people, just really common. So injury, it could be a car crash, it could be something that, just life.
Maybe an answer, I hope so.
Or sitting.
Or sitting, yes.
We need to stand up more
That's
often.
right, yes we do.
There are more than 3 million cases of lower back pain in the U.S. every year. Most people get a little relief after a few weeks or months.
Yeah, but for some people, that pain becomes chronic. CBS 4 health specialist Kathy Walsh joins us, and those people can be miserable.
That's right. Every day can be a challenge. They try everything from physical therapy to pain pills, but they get little relief. Well, now, there's a clinical trial of a new device that could be a game changer. Michael Hewerman works from home. He's at his computer 8 hours a day, 5 days a week. Every day he's in pain.
It ranges from just a dull ache to a hot knife in the middle of your back.
Lower back problems. The misery started about 7 years ago after Michael was working on the engine of his car.
Physical therapy, massage, chiropractic, acupuncture.
Michael's tried everything short of surgery to get relief. Pain medications help, but he worries about side effects and addiction.
It wears you down. It's like having this monkey on your back.
Michael's biggest concern is his son, Braden.
He wants to wrestle, and I have to say, tomorrow,
This dad is now placing hope in Dr. Vic Patel at the University of Colorado Hospital and a clinical trial of a device called Reactivate.
This device is implanted under the skin.
Leads are then placed on each side of the spine.
Right down here next to the nerves.
The device stimulates the muscles internally
to strengthen them and better stabilize the spine.
And hopefully reduce pain.
Some days you're just at your wit's end.
Michael hopes with Reactivate, those days will finally be over. This surgery is done through just 2 small incisions. The hope is it proves to be an alternative to a much bigger back operation. For more information on the study and to see if you qualify, you can go to cbsdenver.com.
Certainly sounds promising. We'll see. All right, thanks, Kath.